Hi there, this is Eli Briggs. I'm Senior Government Affairs Director at NACCHO, and thank you all for joining us today. We're very excited to provide this government affairs update related to COVID-19. And we're going to share some slides with you, and then we will have some time for discussion, hopefully at the end. And also we have the chat box available for folks as we go through. If there are any clarifying questions, please let us know, or if you want to just jot things in the chat box for us as we go along, we will definitely get to those questions. Excuse me. So if we could go to the next slide. These are our objectives for today. We will provide an overview of NACCHO's COVID-19 response. We will also review and summarize congressional action, and there has been a lot of congressional action, and even up to yesterday, there was action that we will be updating you on. We will talk about NACCHO's legislative priorities, and you will learn how you can take action if you're not already, and how you can stay connected with NACCHO during this very important and fast-moving time with everything that's going on. So if we could go to the next slide. I just mentioned this about the chat box, and when you include your questions, please include where you're from, particularly if you're with a local health department. We'd like to know that. And for folks, we are recording. For folks who watch this later, our contact information is on the slide at the end, and you'll be able to have information for how to reach out to the government affairs team. So NACCHO, as folks know, I'm sure if you're on this webinar, and especially if you're with the local health department, we hope that you're aware that we have been responding to COVID-19 since, I believe, late December 2019 was when our response started. And our number one priority is to hear from our members what's going on with you all and what you need. And we know that that's changing day to day and week to week. So we have various ways that we reach out to members and gather that information. And we always want to be as responsive to your needs as we can. We are currently activated at a level 3, at level 3 with a full incident command structure in place. There's a very extensive structure of people from throughout NACCHO, led by members of our preparedness and infectious disease teams, but certainly there's probably not any part of NACCHO that is not engaged, from membership to, like I said, infectious disease, all of the different program areas, government affairs, and our media relations team. We are all completely engaged in this response. And as well as NACCHO has an official role with the federal government, we have been for weeks now involved with the National Response Coordination Center. And we've been embedded with both the Assistant Secretary for Preparedness and Response Operations Center, as well as the CDC Emergency Operations Center, and in pretty much constant contact with our federal partners. And there's more information there at the link that you see at the bottom, where you can find out more about NACCHO's response to COVID-19. Next slide. We have a virtual community on our website, which is a place where you can go. You need to log in and have a NACCHO account, but it's free. to log in and create that account. And then you have access to all the latest information that we are gathering and collecting, and as well as different avenues to discuss issues with other local health department staff, so that it's really intended for as a way for us to get information quickly to our members, as well as for you all to talk to each other, because we know that what's being experienced in one part of the country, if it's not already happening in another part of the country, it probably will be. So it's a good way for folks to talk to each other and learn from each other. So that is on Virtual Communities, and you can see the link there on the screen. And we also have Thursday afternoon every week, we've been having calls over Zoom with preparedness staff from throughout the country, and that gives us another way to update folks immediately about things that we're hearing, as well as to gather information quickly, because a lot of what we're doing right now is being a conduit for information, both from the local to the federal level, but from the federal level down to the local level. So that is another way that we, another quick way for us to get information out and to gather information from you all, which is really important in this time because things are so fluid and changing so fast. Next slide. So now to get to the meat of what we wanted to talk about today, congressional actions, and Congress has been, I would say, fully engaged since about late February on the COVID-19 response. There are 3 pieces of legislation that have been passed and signed by the president, and you can see those there on the screen. And we'll go into more detail on each of those. But the timeline here is incredibly quick, and you can see that March 6th, March 18th, and March 27th. So in pretty quick succession, Congress jumped in there to provide relief, and NACCHO has been engaged in discussions on all of those different pieces of legislation. And then you can see there on the screen phase 3.5, which is the way we're referring to a bill that passed yesterday in the Senate, and it will be, we anticipate that it will be considered by the House tomorrow. So we'll give you a little more update on that in just a second, but if we can go to the next slide. What we call phase 1 was the bill passed on March 6th. It was $8.3 billion in the Coronavirus Preparedness and Response Supplemental Appropriations Act. This was obviously the first of several, and NACCHO and our members were actually, coincidentally, we had about 60 of our members up on Capitol Hill on February 26th. And a big part of what they were doing was advocating for this first response package, which you can see there, $2.2 billion was made available to the CDC, and $950 million, or almost half of that funding, was intended for local and state health departments. And that money got out of CDC pretty quickly. As things go in the federal government, this is lightning speed. March 11th, $560 million was allocated to states, 6 cities, city health departments, and the Cherokee tribe. And those 6 cities are the 4 that are routinely receive direct funding from the Public Health Emergency Preparedness Program, which are Washington, D.C., Los Angeles, New York City, and Chicago, and then it added Houston and Philadelphia to that. And and then we had about 3 weeks later, almost a month later, $160 million was allocated to the same states, 6 cities and the Cherokee tribe, and $10 million went out the door for epidemiology and lab capacity. And then, so this is also in the phase 1 bill, money to replenish the Infectious Disease Rapid Response Fund. That was a fund that NACCHO helped to create a couple of years ago for a situation such as this, where we needed money to get out quickly and didn't have time to wait for Congress. So there was money that went out pretty quickly from the Infectious Disease Rapid Response Fund, and that money needed to be replenished. So that happened out of the phase 1 bill. There was also some funding for community health centers, as well as National Institutes of Health to begin the vaccine research. This is not an exhaustive list. These are just some of the highlights in that bill. And if we can go to the next slide. So then pretty quickly after that, we saw the second of the 3 bills on March 18th, the Families First Coronavirus Response Act. This bill was really to allow people across the country to do what they needed to do in order to be safe during this time of states beginning to go to shelter-in-place orders and really restricting activity, including a lot of businesses starting to be hard hit then in the middle part of March. So it allows paid sick leave for folks to be able to stay home if they are sick or to take care of family members. And then also helps to deal with childcare issues if schools are closed, which now many schools are closed and childcare is not available necessarily for folks. So this also helps with that, with those needs. There's also in response to a lot of the needs around people becoming unemployed. You see an expansion of the WIC program and the Emergency Food Assistance Program. And if we can go to the next slide. Additional funding going out to the Indian Health Service, and also an increase to the Medicaid match rate for states to help them make sure that folks have access to treatment if they need it, and without, so that helps state coffers to not be as impacted by the Medicaid influx. And then the cost of testing for COVID-19 was covered without copay. That was also included in this bill. So then if we go to phase 3, which was a couple weeks later, March 27th, the Coronavirus Aid, Relief, and Economic Security Package, or CARES Act, $2.2 trillion. We see another $4.3 billion for CDC, with a set aside of $1.5 billion for health departments. This money has not been allocated yet by CDC, so that is something that we're anticipating will be happening soon. There's also in this bill, a little bit different from the others, there's funding that goes directly to FEMA, which is for state and local governments to cover their costs. And so that's not just health costs, but can cover any other costs that they may have incurred related to COVID-19. And then something that NACCHO has been a strong supporter of, there's $500 million in this bill for public health data modernization. This is not just at CDC, but also for local and state health departments to make sure that as the data is flowing about from electronic medical records, as well as the testing data, that we can get access to this, and we're not waiting for information to be emailed or somehow sent in a non-seamless way. That this is intended to really ramp up the status of of data information technology at this local and state level, as well as at CDC. And phase 3 included a bunch of other things. There's money for the Biomedical Advanced Research and Development Authority for medical countermeasures and vaccine purchase. This is to make sure that hopefully eventually there is a vaccine and that there will be funding for the government to purchase the vaccine. This goes along with there's also additional funding for strategic national stockpile in this bill. There's funding for the hospital preparedness program, Ryan White AIDS program. Again, you see the infectious disease rapid response fund, community health centers getting another influx of dollars, and rural hospitals specifically being called out for 150 million because there is a lot of concern, or even before this, there was a lot of concern around rural hospitals needing to potentially close their doors if they because they are on such tight margins and don't have the large patient populations of urban hospitals. So there's funding for them, as well as 425 million for the Substance Abuse and Mental Health Services Administration, because we know that there is going to be and is already a huge mental health component to this crisis. Next slide. So phase 3.5, I told you that we were going to give you up to the minute information. This is from the bill that passed yesterday, April 21st. The Senate passed a bill, primarily a lot of the talk in the media was around the Paycheck Protection Program, which provides funding for small businesses to keep them afloat. So there is funding in there for small businesses, but there's also some additional public health funding. There's $2 billion to go towards public health emergency preparedness grantees' ability to do surveillance and contact tracing. There's also a huge expansion in this bill, about 25 billion for testing. But along with testing, there's an emphasis on the surveillance and the contact tracing once testing is more available. And then there is additional funding for CDC to continue their activities. And then, like I said, there's money for small businesses and for hospitals. And with this, if we can go back for just a second, with the 3.5 bill, we do anticipate that the House will take it up tomorrow. They are figuring out whether they are going to come back to Washington or whether they're going to be able to vote remotely, which is something they've never done before. So that is all being worked out today, but we do anticipate there will be another package, which is, of course, phase 4, which I believe I'm turning it to Adrian to talk about phase 4. If we can go to the next slide.
Thanks, Eli. This is Adrian Castellati, NACCHO's Chief of Government and Public Affairs, and thank you again for joining us. We really appreciate it. We know how hard it is to take time out of your day to be here, given the response, but we also are hoping that this is useful for you now, and those of you who are listening to the recording who couldn't make it live, welcome to you as well, and please reach out if you have any questions. So as Eli was talking about, there's been a ton of movement on trying to respond to coronavirus in Congress. And for those of you who lived through the Zika days and almost a year's worth of talk, no action, it really has been lightning speed that these things have been passed, and real incredible attention that's been paid to the response kind of week in and week out for the past few months. Our upcoming legislative priorities, as Eli talked about, the first phase, we were here on the Hill for our Hill Day. Thank you to any of you who were with us to do that. It was really an amazing opportunity where we had over 100 meetings on the Hill talking through the early stages of the coronavirus response and what resources were going to be needed there. But other things that were being spoken about were these broad issues that continue to plague local health departments to be able to really respond as best as they can to any given crisis. And so while the first phase was about initial money for the response, the second phase was about how do you make sure that all the systems are in place that people can actually follow public health directives, like how do you quarantine, making sure you can get tested without copays, et cetera. Phase 3 was really talking about the economy as well as additional funding for the response. This phase 4 is we want to make sure that either in the next package or one of the next packages, we start really thinking about the long game when it comes to coronavirus, not just about what we need to get to the through the next month or 2 months, but really what do we need to sustain our response, and what do we need in place so that when the dust settles on coronavirus, our health departments are still there, they're strong, and they're able to pick up the pieces on all the other public health issues that haven't been addressed to date or that have had to curtail services or supports to their community. They're all going to kind of rear their heads at the end of this, and how we're going to make sure that health departments are strong to do that work, while we know that there's economic impacts to coronavirus that are they're going to try and undercut the budgets of local health departments. So here you see a list of our upcoming legislative priorities. Mind you, these things can evolve, but they've been pretty consistent when we think about that long-term systems piece for what we're focusing on. And we'll walk through each of them and kind of talk about how they're fitting within possible packages in the future. So next slide, please. So the first is public health workforce. I don't know how many of you heard me say this, but from the moment I got to NACCHO, the thing I heard most from our members is issues around workforce. The local health department workforce has lost almost a quarter of their staff since the recession in 2008. And with that, that means there's a quarter fewer people who are there for the response for any given issue, let alone the day-to-day work of public health departments. That's a huge problem. And at the same time, we have recruitment and retention issues. So it's hard to get the right people into certain jobs, and then it's really hard to keep them because of, not great salaries, not great hours, really hard work, and lots of other opportunities outside the governmental public health system. What we know, though, is that the expertise that people have, especially when they live through a crisis like this and work through a crisis like this, is invaluable for the preparation and action when the next issue hits. And so we really want to make sure that we are supporting the recruitment and retention of people into the governmental public health workforce. Our public health workforce loan repayment program is the first way that we are trying to address this. So that the proposal is to reward individuals for coming in to the work in a local or state public health department or tribal public health department. And over the course of the time they're getting a certain loan repayment each year to help remove at least one of the financial burdens to taking this work. We've had amazing conversations in the stakeholder community. We have over 60 additional organizations helping to support this with this effort with us. And on the Hill, we've gotten a lot of really great attention to it as well. In fact, just today, an official piece of legislation is being introduced to support this effort on the House side, bipartisan, from Representatives Crow of Colorado and Dr. Burgess of Texas. So it's a really great step forward to see these concepts that we have been pushing to try and set up a program similar to how National Health Service Corps has the ability to recruit and retain people to the areas where they have need. We want to be able to kind of do that for the public health department that might be just a few miles down the road and have the same challenges. So we're really excited that a bill has been introduced. We also know there's a lot of interest on the Senate side as well. And we will see kind of how that legislation and those opportunities move through Congress, but we're really hopeful that this will be at least one step to help bring a bit more force to our workforce, both now in coronavirus, but also in the future. This is particularly relevant now, as well as we have more and more people who are thinking about, now they understand a little bit more what public health does. They're thinking of that as a career field. They might be volunteering and getting really great information and experience about what it's like to work in public health departments. And so we really want to capitalize on that as well. So we feel like the time is right for this important opportunity. Next slide. All right. So we recognize that we need to do more to recruit and retain, but we also need to do more to ensure that we have jobs that we can post for. We need the dollars to support the broader infrastructure and working of health departments. This couldn't be more, the light on this couldn't be more clear. We know that health departments' budgets did not recover from the 2008 recession on average across the country. On average across the country, NACCHO's own data show that large health departments are working with about, on average, 30% fewer dollars in their budgets than they were in 2008, not accounting for inflation. And small health departments have lost about 11% of their budget since 2008 on average, again, not accounting for inflation. If you account for inflation, those medium-sized health departments are barely breaking even. So when you have those forces that come out of a recession that is 12 years ago, we can only imagine what the coronavirus is going to do and the economic impacts of this is going to do to the local and state budgets that help support public health departments in their work. That's why we're working in coalition with other partners to try and really shore up infrastructure writ large through a set aside of a lot of money, $4.5 billion in annual funding, so that health departments can have some funding for their broad operations and help ensure that essential activities are available at health departments across the country, and that your zip code does not necessarily matter when it comes to whether or not the public health system around you is strong. You can read a little bit more on the specifics of that on this slide. Again, this is really important. Already we know of local health departments who are furloughing staff during the coronavirus response because of hits to the budget. Not only is that a reduced tax revenue from the economic impacts of coronavirus, but also delays in the tax date. And while we know that eventually our country is going to recover from this, in the meantime, our health department is really going to be able to survive and have the right amount of services and that communities need. And we want to make sure that there's federal funding to help support that. Next, please. Contact tracing. So just last week, NACCHO announced a new position statement on contact tracing. We recognize that there is a lot of interest in how do we get out of this shelter in place, self-quarantine space that so many of us around the country are in. And there's been a lot of talk about how intense amounts of testing so that you can find as many cases as possible, followed up by intense contact tracing that's done quickly, so within a couple hours, not necessarily a couple days, gets people into quarantine to try and stop the spread of the virus before people when people are either pre-symptomatic or when they're asymptomatic as well. That's a huge order. We know that local health departments have key skill sets in this. We have GIS workers and others who are working traditionally who do this type of work, whether it's in your HIV, STD, or viral hepatitis programs, TB, etc. So we know we have the expertise to understand how to do this. We also recognize that to do this on a national scale all at once, because pretty much every community across the country is at some risk for this, is a massive undertaking. To help inform this from the local public health department perspective, we released our contact tracing memo to make sure people understand how this could be operationalized, basing it on the existing skill sets and structures of local health departments. So we estimate that we need at least 100,000 new contact tracers to do this work. Those would be paid individuals. On average, we think that would cost at least $3.6 billion. And we also recognize that there's a lot of interest in volunteerism and how people can get connected to their local health departments to do their part, even if they're not doing it in a formal way. And to do that, we think that the best ways to really strengthen our medical reserve corps units across the country to let them continue to facilitate volunteerism. But we know that they have been really stripped of funding in recent years. So our proposal also includes $100 million to help shore up MRC units across the country. And that seems like a lot of money, but in all things local public health, when you do the division, it would be $100,000 per MRC corps to really stand that up and let them bring in volunteers, train those volunteers, and manage those volunteers. That's not really a lot in the grand scheme of things. So we recognize when we're deploying money out across the country that you really have to make sure that there's enough to reach all the corners. The other thing that we really wanted to highlight in our paper is removing some of the barriers to hiring. On a good day, it's hard to hire a lot of people. When everyone is working 20-hour shifts to try and combat coronavirus, it's even harder to try and take time out to do that work. So removing barriers to hiring, and then also to think about how we can equitably distribute the resources and people that come into this to this surge in contact tracing capacity. We have health departments that serve wide range of numbers of population, but they all need a certain number of skill sets in their health department to make this work. And so we want to make sure that it's being distributed not just on a per capita basis, but some sort of baseline of what does a local health department need, and then you can scale up based on your the population that you serve after that. So those are some of the key pieces that we have added to this conversation going on at the national level. And Congress is really taking note as they try and figure out how many people and how they're going to be funded and how you actually operationalize this. So this is another key piece for us. Next slide, please. Finally, we have an opportunity. So many parts of the coronavirus response have had to be, for better or for worse, done in kind of a crisis moment. We expect that a vaccine is going to be available in a pretty relatively long time frame of maybe a year at minimum. So we have time to prepare of how do we actually, once a vaccine is available, how do we get it out into communities, into people, so that we can really start changing the face of the coronavirus pandemic. So we're trying to alert the Hill now that if we can make the investments now, make the policy adjustments now, then we can actually be prepared so that the moment that vaccine is available, we can actually deploy it. That involves things like a vaccination strategy and plan, ensuring we have the sufficient supplies and clinical medical office needs that we have for that. We know all too well the challenges around getting tests out into the communities, and then all the accessories for testing that are necessary, but that we didn't have, that made it hard to ramp up testing as quickly as we'd like to. If we can plan now, we can try and avoid all as many of those issues as possible for when we have a vaccine deployment across the country. Staff capacity, of course, investment in our immunization information infrastructure systems and information systems. That's also critical, because when we're doing deploying vaccine and trying to move as quickly as possible, we want to make sure that we're capturing the data. We want to make sure we understand the saturation of the vaccine in our community, and we want to make sure that those systems can talk to each other as seamlessly as possible, so we don't have to worry about, you know, this state's system not talking to this state, or this state not requiring that the information be put into the system and this one does, and then we have an inaccurate data picture. These are all things that we can invest in and focus on now, so that we're in a much better place when a vaccine is actually developed. And it's one of the few places in coronavirus response where we can really be forward thinking. So we're trying to help Congress do a little bit more of that, as opposed to just trying to address what the problem was of yesterday. Next slide, please. I think I'm about to turn it over to Ian, but just to be, but just wanted to reiterate, it is critical, whether you're listening to this live and joining us right now, or you're listening to this later, we can't do this work without your stories. Very, very early in the response, we were able to get, this is before it became a hotspot, we were able to get information from Seattle King County about how much above and beyond this was costing their health department a week. At the time, it was $200,000, and this is before they had any cases. That was critical information to help put the scope into Congress's head and the media's head around what this is going to take to try and respond. And that's why, as you heard from Eli's presentation, we were able to get $950 million specifically set aside for local and state public health in that first bill, when earlier estimates had been about a third to a quarter of that amount. The more information we have from you, the more we know about how programs are being affected in your community, whether they're coronavirus programs or other programs that aren't happening or aren't being able to really address the public health issues going on other than coronavirus. The more we know, the better we can advocate on your behalf. So now I'll actually let Ian go through this slide, but just to plug, anytime, please reach out to us. What might not seem like a big deal to you could really help inform a large part of our practice. Thank you.
Thanks, Adrienne. And as she just said, yes, we do need your feedback. And so if your local health department has received federal funding from the state health department, or if not, how has your state announced how distribution funds will occur? We also want to hear about challenges facing funding. So if you type out HTTPS with that tinyurl.com/NACCHO-funding, that will take you right to the survey. You cannot you cannot actually click on this link live, though we are going to send out the slides later and you can click on it then. But if you just take the time to put that in your browser right now, that will take you to our survey. So NACCHO, we have several advocacy campaigns happening right now that you can take action on that really help with letting Congress know what the needs are of public health at the moment. So if you go to naccho.org/advocacy/take-action, you can take action on 2 items that we have up there right now, which is to urge Congress to pass sustained increases to CDC and core public health infrastructure. And we also have one to urge Congress to establish that public health loan repayment program to help bolster the public health workforce. We really need advocates. We appreciate your advocacy if you have taken action, but these 2 campaigns will really help with hopefully the phase 4 package going forward. So there are several ways that you can stay connected to NACCHO for the latest information. The first is to join the Congressional Action Network. You can go do that by going to naccho.org/advocacy/take-action, or if you go to the naccho.org website and there's a drop-down menu, you can click on Take Action there, and that will take you to our advocacy portal. And there is a sign up in the right-hand side there of the box, and you can sign up that way. We don't inundate our advocates with emails. We send emails at pertinent periods of time when timely action is needed. And so it's really great to get out there, make your voice heard, and become a public health advocate. There's also News from Washington. News from Washington is our weekly e-newsletter. It features the latest happenings in Washington, D.C., such as these coronavirus packages that we have just mentioned. And you can find that, again, by going to naccho.org/advocacy/news, or you can go to the naccho.org website and hover over the public health advocacy section, and there's a drop down there and click on News from Washington. Finally, we have the NACCHO podcast series. It is a bi-weekly podcast featuring guests from all public health backgrounds, including the latest in COVID-19 updates. If you search for the NACCHO podcast series in your podcast app, it will come up and you can just click subscribe. We also send these out in the News from Washington e-newsletter. We had some really great conversations. Most recently, we had with Crystal Miller from Kentucky, the Wedco district at the local level, and then also Dr. Stephen Stack at the state level, and just talking about the state and local health department coordinated response. It was a really great conversation. And we have lots of other podcasts in the queue ready to go. So please stay tuned for that, and please search for the NACCHO podcast series. We were also named top 30 best public health podcasts, so we were very honored to have that. Finally, NACCHO Communications, always follow us on Twitter for updates at NACCHO Alerts. Also on Facebook, we are NACCHO HQ, and on Instagram, again, we are NACCHO Alerts. The NACCHO Twitter and Facebook are very active, as is Instagram, but Facebook and Twitter have a lot of great information on the latest public health happenings at NACCHO. And with that, this is our government affairs staff. If you have any questions at all, please do not hesitate to reach any of us. And with that, we will open the chat for any questions that you might have. And I'm actually going to unmute the lines at the moment so you can ask questions as well.
So Ian has unmuted the lines, and so that means that everyone is live. So if you don't have a question, you can put yourself back on mute manually. We are here to answer questions as folks are thinking about them. You know, the situation continues to be super fluid. So we do try and keep everyone updated by news from Washington, as Ian talked about. What he didn't highlight as much is that his podcast series is now really focusing and making sure we have a strong connection on coronavirus. So we're having some special episodes coming out in that way too. So a great way to listen when you're driving or doing something else and you can't read and keep up with what's going on from our perspective. But we are putting these things out in all different ways to try and make them as useful for you all and as accessible given everyone's incredibly tight time constraints.
Yep.
I know that one of the participants had to hop off and she had asked about using these slides, being able to access these slides. So as we said, we will be sending them out to everyone. If you need specific information that you need to present to somebody else, say, you know, trying to understand how the funding is coming through or what the federal choice decisions are that are being made and how that impacts you locally, also reach out to us because we're happy to try and collaborate and give you the best sense of what's going on as the stuff in Congress is clearly changing minute by minute, if not day by day.
Adrian, we have a question.
Sure.
What has NACCHO decided as a testing strategy? This is from Richard Theron.
So NACCHO's worked really closely with other national stakeholders, including the public health labs and others around trying to really promote testing and ensuring that we have the level sufficient that we need to really understand the level of infection in communities, as well as to then be able to follow up on them. In order for us to get to a place where we really can start reopening communities safely, testing is a key component. There needs to be more of it. It needs to be quick, it needs to be faster, so that you can act on results more quickly. We recognize that there are still a lot of challenges with both having tests available, having the supplies available to really actually be able to do the tests that are beyond the test kits, and the personnel to do it, and then also having enough PPE to be able to do all the testing that you'd like. Communities over time, we support our local health departments who have had to make tough choices on how to prioritize testing, because whenever they are looking at that information, they have to kind of make the determination of, okay, what's our capacity? What are our supplies like? And what can we do given the level of spread in our community right now? So we know that a lot of communities have prioritized healthcare workers, people who are particularly sick or in vulnerable populations. But as a nation, we really need to get to a place where we are able to do more broad-based testing so that we can get to being able to reopen our communities.
As a follow-up, Adrian, what is the best analytical method for testing?
I don't know that we don't have a statement on the best analytical method for testing. And so I don't want to speak to that. Congress has certainly not gotten into that level of detail. I think they're really still focused on the how do we do it enough? How do we get it to a level of capacity where we're really able to start making some well-founded decisions based on the data.
Another question from Justin. Do you have more information about the programs that would be in scope for the proposed loan repayment programs, as an example, MPH, PHN, et cetera?
Sure. So one of the things we wanted to be really cognizant of in the loan repayment program is that the public health workforce and the local health department workforce comes from a variety of backgrounds, and that's actually a strength to being able to fill the many different roles and needs that public health departments have to do the work. So it does not limit the degrees to say just a master's in public health, and I have one, so I like them. But it really allows for the discretion to be placed on the health department for who they are planning to hire. There are the legislation that was introduced today remains neutral on what degrees or any of those parameters. We have also been working on a list of what would be ways that we could describe a public health role that really allows for the broad needs that might be there. So, you know, a public health or healthcare program that would help get you, you know, all your MPHs and all your public health nurses, medical directors, that kind of thing, but also really wanting to make sure we allow for people with informatics backgrounds and degrees and other associated tracks that really have skill sets that are important for health departments, social work, obviously, and others. So we're trying to make sure it's as expansive as possible. So it's really placed on the health department to choose the best candidate for those roles.
Adrian, another question. What is NACCHO's advice on supportive care strategy for COVID-19 patients?
So one of the areas where we have been trying to focus some of the conversation, and phase 2 got at this a little bit. We were talking about this in the media and on the Hill before phase 2 even really came into form, which is how do we make sure that people who have coronavirus, may have coronavirus, are sick but not being tested, or not being, but not sick enough to be tested or put into the hospital, people impacted by the school closures, et cetera. How do we make sure that all of those people are able to make the public health choice the easy choice for them? For example, if you have someone who is contacted, especially in this next round of where we think we're going with our communities, we've reopened communities, but someone tests positive, you do the contact tracing, you start calling people within an hour or two of getting that list of who might be at risk. And you say, great, I need you to stop everything, go home and stay there for 14 days. That's hard. That's hard for people with means. That's hard for people like me who have a giant freezer in the basement because my children eat me out of house and home. That's particularly hard if you don't have those things. Maybe if you're experiencing homelessness, if you're worried about losing your job or anything like that. So we have really focused on trying to make sure that people are recognizing that they need to do more on the social supports, whether that's food, maybe laundry services, having a safe place to stay. You might be experiencing homelessness. You might also live with people who are particularly vulnerable and not want to be quarantining in that space and putting them at risk. Childcare, mental health services, et cetera. What are all those things that are needed for someone, whether or not they are infected, suspected, or suspected cases, so that they can actually do what we as public health professionals are asking them to do, and to make that transition a little bit easier.
Adrian, a question from Sarah Sanders. Any thoughts on how to retain persons who enter the environmental health, public health field via contact tracing? Great question. Yeah,
and that's why we're really pushing the loan repayment program now. If you've heard anything from any of the three of us over the past few months, you've heard about this program, but it's really adding a new level of impetus to why we need to get this up and running now, because there are going to be so many people who come into the system through this contact tracing mechanism, and we want to be able to recruit and retain them to stay. Not only is it better to have people who have skills, but also we need to be able to build on this, because we don't know what the next crisis is going to be, but we know there will be one. And so having this experience is critically important for the early stages of response for whatever the next issue is. So the loan repayment piece is one of those. We've also been pushing with Congress to make sure, and the infrastructure bill of trying to really fund health departments writ large is another piece of that. So if we have the funds to really have the different aspects of what health departments can do be funded, so they can actually be building out those systems, then we'll have a better chance of having those jobs that people can come into. But it's a critical point, and we don't want to build up all this talent and then just say goodbye and never see it again after we train them up for this response.
Great. Another question, Eli, if you want to take this one, so Adrian, you can get a drink of water for a second. What does NACCHO recommend for influenza vaccine preparation in the fall?
Sure, thanks. So we recommend what we always recommend, which is everyone should get a flu shot if they are able to, and recommended by their physician to get one. We have longstanding policy that you can find on our website on the advocacy section about influenza vaccination. But this year it's going to be particularly important, obviously, And I don't know if folks saw the CDC director, Dr. Redfield, was, I think yesterday, was talking about the fall flu season and how it could be a real double whammy with if we get a resurgence of COVID-19 and flu at the same time. So that obviously, when we talk about flattening the curve, we want to keep people out of hospitals, and whether they get there through contracting COVID-19 or the flu, we do not want to overwhelm our healthcare system. So we think that this year, I believe health departments will be doing an extra push on around flu season, but we know that that there are similarities, even though they are not definitely not the same disease, but there are similarities with the symptoms and the treatment for both COVID-19 and for flu. And so we want to, again, just make sure as many people as possible get their flu shot and take care of themselves and keep as many people healthy as we can, is I think the bottom line.
Eli, a follow-up to that. How can industry help your efforts with vaccine and diagnostic development?
I think I'm gonna have to turn that back to Adrian. I think that we are at the end of that pipeline, and local health departments provide the vaccines, get the shots in the arms. We are hopeful that there will be a vaccine for COVID-19, and we hope that there will be a good match between the flu shot and whatever this year's flu strain is going to be. But I think that our concern is mostly with making sure that vulnerable populations are reached and that we get everyone protected as much as possible.
Great. Okay, it doesn't look like there are any other questions. And so I want to thank everybody for joining us today on this webinar. We will be sending out this recording, and we will be sending out slides as well, but please check out News from Washington this week, where you can also find that as well.